I think there's always been concerns from the start of fluoride in the 1940s in this country. Fluoride is a naturally occurring mineral. It's actually a miracle mineral, is what we call it. The mineral actually helps to strengthen and harden the enamel in your teeth. So it is added to our water as a preventive measure that is then ingested, so it's systemic. It works when your teeth are forming, so it benefits when you're a child to actually have the fluoride be in the matrix of the enamel of the tooth. It also is topical in that when you ingest it, it helps to remineralize the teeth that are in your mouth, and it also helps to prevent the bacteria that are in your mouth from producing acid, which cause decay. There's always been pockets and areas that have concerns, but there's been multiple studies on towns that are side by side that have fluoridated versus non-fluoridated, and we see that, the towns that fluoridated, their decay rate drops at least by 25% in most of them, and even more in children.
Albany is the capital of New York State, and it's one of the last large cities not to have fluoridation in their water. When I heard that my own son almost lost his adult tooth because of the lack of fluoridation, I knew something had to be done. I had talked to the mayor about it, but it's a hot issue. It was a tough one. The mayor decided not to run again. So at the beginning of her last term, she decided that, yes, I will take this on. I talked to the water commissioner, Joe Coffey, and he was definitely for it. But politically, it was a tough road to go down.
Health and Human Services Secretary Robert F. Kennedy Jr. wants the Centers for Disease Control and Prevention to stop recommending fluoride in America's drinking water. On Monday, Kennedy praised Utah for becoming the first state to ban fluoride in the water supply and said he hopes other states follow suit. The Environmental Protection Agency also said it would work with the HHS to review the effects of fluoride. Now, Kennedy has made multiple claims about fluoride being linked to several health issues, but many experts say it is safe and has proven benefits for dental health.
So we have, fears that there may be a cancer-causing agent or lowers the IQ of a person. They have fears that it causes a problem with the bones. So they have fears also about staining of the teeth. And all those are unjustified fears. We have 75 years of scientific evidence that fluoride works and fluoride is not harmful. So there's no health risks if they're used at that 0.7 parts per million at that recommended dosage. We do not see those health risks happening.
I think it's the misinformation. One of the things that they're bringing out is, the studies done that fluoride can lower the IQ. Well, there's really no good study showing that. I know there was a study done in China by some Harvard researchers that the level of fluoride in the water was way beyond what is acceptable. And, in China, some areas, it's naturally occurring that there's a high level of fluoride. And so I think for that study, it's definitely, throwing people off.
In the areas that fluoride has been banned and is, controversial, we will see that the amount of decay is going to rapidly increase. We'll see that within 5 years. We also have statistics from the American Dental Association that, after 5 years, it will have a $10 billion effect on, increasing costs to have dental care because of that. There have been several cities that have banned fluoride, and then after 5 to 8 years, they have re-implemented it because they have seen how much decay has come because there's no fluoride, and also the cost to the area because of that. You will see it in the cost of what you have to lay out as far as paying for more dental care on all levels of society.